fossa between the ribs and the scapula, subscapular fossa, and insert on the lesser tubercle of the humerus. The function of this muscle is medial rotation, and also it helps to position the head of the humerus during abduction and flexing through elevation. Right, that is subscapular nerve. The second one is middle subscapular nerve. It's also called the thoracodorsal nerve, and this nerve, it supplies latissimus dorsi muscle. Latissimus dorsi muscle, you all know the latissimus dorsi muscle. It's a muscle, it's a big muscle from the back, from the thoracolumbar fascia, and up, and it insert. Okay, we're gonna mention the three sisters. Let's leave the insertion. We'll mention it when we mention the three muscles that insert on the same area. So actually, what we actually say, this middle subscapular nerve called thoracodorsal nerve is a supplier of the latissimus dorsi muscle. Next to it is upper, middle, and lower subscapular nerve. This lower subscapular nerve supplies the teres major muscle. Right, the teres major muscle. Okay, then let's look. We have mentioned the three branches. Let's look at the other two. This one is lateral pectoral nerve. This one is medial pectoral nerve. So this lateral pectoral nerve will supply the pectoralis major muscle, and this medial pectoral nerve will supply the pectoralis minor muscle and major. This medial one will supply minor and major. Right, let's leave the other two. We're going to explain these two later. But what I want to say, the pec major muscle, the teres major, latissimus dorsi, and the pec major muscle, they all insert around one area. It's a medial lip and the lateral lip on the proximal part of the humerus. These three muscles, teres major, latissimus dorsi, and pec major, they all insert in the same area, and then they are called three sisters. They are supplied by these nerves that I just mentioned. So now we are left with these two. These two, they don't, it's a sensory nerves. The one that I was mentioning is motor because they supply muscle. These two, it's a sensory one. These two, they take information from the skin, sensory information to the skin, back to the central nervous system, that is spinal cord and the brain. So these two is called medial cutaneous nerve of arm. The other one is medial cutaneous nerve of forearm. Okay, just keep in mind that we have these two. When I do dermatones and specific, when I do dermatones, then I'll refer to these two nerves. But what I can just say for now, these are sensory, they supply the skin. So the medial part of the forearm, that part of the forearm, this part, the medial part of the forearm is the one that is supplied by the medial cutaneous nerve of forearm. The medial part of the upper arm, which is where the bicep brachii is where it's supplied by this medial cutaneous nerve of arm. Okay, we can keep it like that. Okay, let's focus to the main terminal branches of the brachial plexus. right? I think you will be familiar with these nerves because they are the one that are very familiar. The one that I was explaining, trying to explain in detail, most of the students are not familiar with those nerves. They ignore them, but they need to understand them, right? The terminal branches. We said when we spoke about divisions that these divisions, the anterior division will eventually become anterior terminal branches that will supply flexors. So if you look at the anterior division, this is anterior division, this is another one, this is another one. They all come down and make this M. If you can follow, this M is like M. These are terminal branches from the anterior division of the brachial plexus. Mainly this is called the musculocutaneous nerve. This is median nerve. This is ulnar nerve. Right? Okay. The ulnar nerve, the median nerve, and the radial nerve will have separate presentation for each nerve, and follow those muscles. And because I will just for now mention some few muscles that are supplied by these nerves. The only one that I will explain for you now is the musculocutaneous nerve, this one. And I will also explain the axillary nerve. I'll also explain the radial nerve. But when we do separate videos for the terminal branches, I will repeat the radial nerve, the median nerve, and the ulnar nerve. Right, let's start for the posterior branches that will supply the posterior part or the posterior muscle. If we follow there, the posterior cord, and then you can see it breaks into axillary and the radial nerve, which means the axillary nerve will supply the dorsal part of the arm and the radial nerve will supply the dorsal part of the arm, because they are part of the posterior cord. We said the posterior cord will supply mainly the extensors of the upper limb, right? When we look at the axillary nerve will cross posteriorly through a space that is called quadrangular space and supply, because we mentioned the other three muscles of the rotator cuff. We said supraspinatus and infraspinatus are supplied by the suprascapular nerve. And we also said that the upper subscapular nerve will supply subscapularis, which the three muscles of the rotator cuff are already supplied. So there is one that is not supplied. That one that is not supplied, which is teres minor, is supplied by axillary nerve. So axillary nerve supply teres minor. It also supply supplied posterior part of the deltoid muscle, and it also supply a skin around the area of deltoid muscle. So this axillary nerve will supply teres minor, deltoid muscle, and the skin over deltoid muscle. So which means this nerve is mixed nerve, is sensory and motor, right? And then the radial nerve. Okay, bear with me, the radial nerve is supplying a lot of muscle. Then I'm going to mention all of them, right? Radial nerve is a nerve that is injured when somebody sleep over the edge of the chair, because this nerve is situated under the armpit. So when somebody put the hand over the back of the chair and fall asleep over that part, then there will be an injury of a radial nerve. There will be a paralysis of radial nerve. So now the radial nerve will supply all the extensor muscle, starting from the extensor of the elbow, that is the triceps brachial muscle. The triceps brachial muscle is a muscle with three heads. This muscle with three heads is long head of tricep brachii, lateral head of tricep brachii, medial head of tricep brachii. And also this nerve, you can palpate it between the long head and the lateral head of the tricep brachii muscle. Or you can also palpate it along the radial groove posterior to the humerus. You can still palpate it there, right? So it supplies the triceps brachii muscle, 3 heads of the tricep brachii muscle. The unconeus muscle is not supplied by the radial nerve. That's the only one extensor muscle that is not supplied by the radial nerve. So it's triceps brachii muscle, brachioradialis muscle. Brachioradialis muscle is one of the extensor muscle that originates from the lateral supracondylar ridge of the distal humerus and insert on the lateral part of the shaft of the radius. Is called brachioradialis. Is from humerus to the radius. Brachioradialis is triceps brachioradialis. Next to brachioradialis, the way that I mentioned this muscle, because it's the order where is the way they are situated along the forearm. So the radial nerve supply tricep brachii muscle, 3 heads of tricep brachii muscle. It also supplies brachioradialis. It supplies the extensor carpi radialis longus. The extensor carpi radialis longus originate from the same area like the brachioradialis muscle, the lateral supracondylar ridge, and insert on the base of the second metacarpal. Okay, let's continue. The third muscle supplied by the radial nerve is called the extensor carpi radialis brevis. The extensor carpi radialis brevis originate from the common extensor tendon and insert on the base of the third metacarpal. This radial nerve also supply the extensor digitorum. Extensor digitorum originates from the common extensor tendon and insert to the digits to the third. It is the one that insert to the digit, right? The extensor digitorum. Then we have the extensor digiti minimi, that is also supplied by the radial nerve. Then we have extensor carpi ulnaris, that is supplied by the radial nerve. Then we have the extensor indicis, that is supplied by radial nerve. Then we have other 3 muscles that attaches to the thumb, the abductor and the extensor of the thumb. Those 3 muscles, they are all supplied by the radial nerve. The names of those muscles is called the abductor pollicis longus and the extensor pollicis brevis and the extensor pollicis longus. They are all supplied by the radial nerve. I think I just have to repeat the number of muscles that are supplied by this nerve, by the radial nerve. So the palsy, the injury of the radial nerve, will affect all those muscles that I've just mentioned. And this radial nerve is a mixed nerve. There's branches that will go and supply and take information from the skin, but that part will deal with it when we do dermatomes. Right, let me just mention the muscle again without mentioning the original insertion. This radial nerve will supply the triceps brachioradialis, extensor carpi radialis longus, extensor carpi radialis brevis, extensor digitorum, extensor digiti minimi muscle, and extensor carpi ulnaris muscle, extensor indicis muscle, and the abductor pollicis longus, extensor pollicis brevis muscle, and the extensor pollicis longus muscle. And lastly, that I did not mention, it also supplies the supinator muscle. It also supplies the supinator muscle. That is radial nerve. Right. Now let's go to the nerves from the anterior division. The anterior division. The anterior division will become terminal branches that will supply the anterior part of the upper limb, as we said. So we have this M, which are three terminal branches: the musculocutaneous nerve, the median nerve, and the ulnar nerve. I won't mention the muscle that are supplied by median nerve and ulnar nerve. I'll just save it for that video when we do the median nerve and ulnar nerve. But we're gonna repeat the radial nerve and do a separate video that will deal with the median nerve, because it's very important. Let's look at the musculocutaneous nerve. The name is self-explanatory. Muscular, it supplies muscle. Cutaneous, it also supplies skin. They normally give a nickname to this nerve. They call it BBC nerve. Why they call it BBC nerve is because it supplies muscle that start, the first muscle is start with B, and another one with B, and another one with C. So they call it BBC nerve, which means it supplies biceps brachii muscle. It also supplies brachialis muscle, and it also supplies coracobrachial muscle. Bicep brachii muscle, we all know, is a muscle with two heads situated anterior to the humerus, and the function of this muscle, the main function, is elbow flexion. The origin of this muscle, since it's got two heads, one head, the short head, originates from the coracoid process of the scapula, and the long head is situated along the intercubicular groove and originate from the supraglenoid tubercle. It's a bump, or it's a bump just above the glenoid cavity, supraglenoid tubercle. And the insertion of this muscle, bicep brachii, it inserts on the radial tuberosity of the radius. And also there is an extension of an aponeurosis that cover over the muscle there as part of the insertion. So the main function of this muscle, and remember this muscle, bicep brachii, is a two joint muscle. It covers the shoulder, it also covers the elbow. So the function of this muscle is elbow flexion. The main function is elbow flexion with supination. So it's supination and elbow flexion. That is the function of the bicep brachii. It also helps with shoulder flexion because it covers that joint, but it's not a main factor there. Right, the brachialis muscle originate from the lower anterior half of the humerus and insert on the ulnar tuberosity of an ulnar. So the function of this muscle, it's elbow flexion, but you need to keep the arm pronated in order to test this muscle. To test the brachialis, keep the arm pronated and then do elbow flexion. And then this one, it only covers one joint, so it only affects elbow joint. Then we said this nerve, it's a BBC. It supplies three muscles: bicep brachii, brachialis, and coracobrachialis. Coracobrachialis is muscle that originate from the coracoid process of the scapula and insert on the medial part of the humerus. The main function of this muscle, it helps with shoulder flexion. Shoulder flexion. That is musculocutaneous nerve. And this part that supplies the skin, it supplies the skin of the forearm. There will be a branch that will break from this musculocutaneous nerve. It's called lateral cutaneous nerve of the forearm. lateral cutaneous nerve of the forearm, but we'll deal with that later. All the dermatomes will deal with it later. Okay, then we have the median nerve, and we have the ulnar nerve. We'll save the muscle that are supplied by the median nerve because the video has become too long now. I think we need to stop here. That was the anatomy of the brachial plexus. Next, what are we going to do? We're going to look at the injuries and the different injuries that affect the brachial plexus. So it's just the foundation that we are laying. Then we're going to look at the injuries that happens to brachial plexus, like the one that happened on during birth, where the child shoulder will be trapped and then brachial plexus will be injured, and then those injuries, the physiotherapy department is also involved in treating all those injuries. So it's quite important to understand that. So we will have all those. The clinic will have a video that deal with the clinical significance of understanding brachial plexus, and then they will mention all the problems that arise from brachial plexus, thoracic outlet syndrome, and all other things that will arise from brachial plexus. Thank you. Let's end there. Just before we end, I just want to show you where, looking at this Netter's picture, where the brachial plexus is supplying. It looks complicated. But if you try to understand what I've just said, you will be able to identify all the thing that I've just said. Because when you understand the structure of the brachial plexus, it won't be complicated to look at this. Because now, let's say for instance, we said this is the sternocleidomystode, and then this is sternocleidomystode, and then behind there is Scalene's muscle, and then Scalene's is three muscles. We have anterior, middle, and posterior, and then we said the brachial plexus is between the anterior Scalene's muscle and the middle Scalene's muscle. And then you can see the brachial plexus coming down there. The clavicle is removed. The clavicle is removed in order to show the mechanical interface of the brachial plexus, right? So, and then as you see, this is clavicle, and then underneath the clavicle, you can see we mentioned the muscle called the subclavius muscle. These are those muscle. That's the origin of the subclavius muscle, and then that's the insertion of the subclavius muscle. Is also supplied by a nerve from the brachial plexus, this subclavius muscle, and then this is brachial plexus, right? And then if you look at it here, this is a lateral pectoral nerve that supplies the pec major. This is pec major. This one is a medial pectoral nerve that we said it supplies the pec minor, and then it goes through and supply the pec major. We said it's two muscle, right? And then if you follow it there, we mentioned the nerve that originates from the roots of the brachial plexus, that we call that nerve the long thoracic nerve. It's called long thoracic nerve because it takes the long way. Down there, and it comes and supply the serratus anterior. The serratus anterior. Here we go. These are serratus anterior muscle that are supplied by the long thoracic nerve. And then you can see, try to figure out the M. We said the M is musculocutaneous, and then the middle one is median, and then this part is ulnar. And then the other two is the one that we said those are two sensory nerves that we're going to deal with them when we do the dermatomes. Right. And then if you look there, let's try to zoom in. If you look there, and you look there, and you look there, these are three nerves that we said they have similar names. we said the one is upper subscapular, this is middle subscapular, this is lower subscapular. The upper subscapular, they supply the subscapularis. The middle subscapular nerve, they supply latissimus dorsi muscle. The lower subscapular nerve supplies teres major. Right. What else we can identify there? Subclavian nerve, artery, you can also see there. And then, yeah, I think we need to stop here just to keep the video not too long so that you'll be able to follow it. I mentioned a lot of things, and at the beginning it seems as if someone can't understand this, but if you follow and you do it over and over, then you will eventually understand and apply this knowledge in order to help you diagnose, treat, and help your patients. Thank you.